Hello, I'm Sanaz Reichwalter with the Family Medicine Program.
And I'm Anthony Adetamiwa with the Pediatric Medical Program. Authority Health is a public agency dedicated to strengthening the healthcare safety net in Southeast Michigan through increased access to healthcare services, enrollment in health insurance programs, building capacity through community health centers, and most importantly, training primary care physicians. Actually, we're really a learning community. Fellows from the Albert Schweitzer Fellowship and other interns rotate through our facilities pretty regularly. We are hosting Future Docs programs for our high school students, whom we love so much as well.
Yes, Anthony, that's why we're here, to learn and share our knowledge with those who follow us. We are fortunate to have Michigan State University College of Osteopathic Medicine as an academic partner. Authority Health residents are credentialed for teaching medical students. Anthony, Authority Health is a teaching health center, one of just under 60 in the nation. Teaching health centers provide a unique experience to receive high-quality training for primary care physicians in the community environment, closer to the homes and workplaces of the people we treat. While we receive our required hospital training in prominent Detroit hospitals, we also have our continuity in the community.
In addition, the Authority Health Teaching Health Center places a high value on principles behind our training, such as understanding the population health, social determinants of health, trauma-informed care, and the importance of anti-racism and social justice. All residents complete a population health certificate program provided by the University of Michigan.
Trauma-informed care is important for programs like ours because the patients we see often suffer from cumulative trauma, even generational trauma. It's important that we understand how adverse child experiences can impact health of the individual later in youth.
Likewise, understanding implicit bias in medicine, as well as becoming active proponents of anti-racism, prepares us to be advocates for improving health upstream, as well as health centers where we will be working. Dr. Ernie Yoder, our Director of Medical Education, in collaboration with New Detroit, created a special 3-year curriculum that provides a deep immersion into the minority cultures of our region.
Speaking of community health, our community medicine rotation is also a valuable elective experience for our residents, a requirement for pediatric residents. Authority Health, as a public agency, is well connected in the community. We have a diverse array of options to pursue, but many of our residents are focusing on health literacy.
That's right. Dr. Carolyn Custer, Director of Community Medicine Rotation, has an interesting program called Wash and Learn. Not watch and learn, but wash and learn, in which residents teach people while they wait for their laundry. It's an important example of meeting people where they are. This program is in the area of the community where we have a school-based health center as well. The community medicine rotation also is developing health literacy projects to augment the education of young people at Hope Academy.
Anthony, I think it would be helpful to share our personal reasons for selecting the Authority Health residency.
I agree.
For me, I wanted the full family medicine comprehensive experience. I wanted to be able to deliver babies, be able to see pediatric patients, and even care for the elderly. That, in combination of working in with an underserved population in an urban setting, were all important factors to me in selecting Authority Health as my chosen residency program.
Absolutely, absolutely. I agree 1,000%. And the same reasons that you came to Detroit are the same reasons I did as well. Detroit provided a unique experience to be able to come and practice, and I'm very grateful for Authority Health and actually being able to bring me here to do so. Being able to be immersed into a culture that spans so many years, whether through the jazz, through music, through the culture, through the food, and of course just the people. So I really wanted to be able to actually come here and just immerse myself in that unique experience. But more importantly, I wanted to kind of give back to a community that has given so much to America as a whole. There's so many diverse issues and of course diseases and illnesses that may plague our pediatric populations. But I really wanted to just give my all back to the community, and I think that's why ultimately for me Authority Health was my #1 pick.
Definitely agree.
So what's like a typical day for you, Sanaz?
Great question. So a typical day would be like right here at the Pop-Up Health Center, strolling in at 9 a.m. with our morning huddle. So we get a look to see who are all the patients we're going to care for that day and see how can we coordinate and organize their care together. And then throughout the day, I'm just working with the rest of the staff to be able to meet all the needs of our patients and sending them home with a smile on their face. What about for you, Anthony?
No, that sounds really good. We typically start around like 6 a.m. or 6:30 or so on the inpatient rounds, where we get a chance to go and see our patients bright and early, wake them up right before they get a chance to brush their teeth, and just ask them about their day, their night, ask them about their symptoms, of course, and then go forward and round with our attendings and the rest of the team, from medical students and PGY 1s, 2s, and 3s on a typical day. And then thereafter, of course, like we'll meet with like case management and social work just to be able to make sure we have everything that's needed for our patients and their care. And whenever we're on the outpatient side in our clinics, we typically start around the same time as well, which is very refreshing at 9 a.m. And then, of course, do the same things, being able to give the best and all that we can to our patients.
That's amazing. Anthony, many medical students will be considering traditional hospital-based training programs, but we're really different. Authority Health is a consortium model. We have many different institutional partners offering a diverse training experience.
Yes, Sanaz. On the hospital side, we're affiliated with state's major children's hospital, as well as urban and suburban tertiary hospitals. Our residents often excel among other residents from other programs in the hospitals where we train.
Also, we have a diverse array of community partners, beginning with our own family health center, pediatric health center, and school-based health center. We also have affiliations with federally qualified health centers and community mental health facilities.
We believe that we are the solution for primary care physician shortage in America today. More than 60% of our residents establish their practices in medically underserved areas.
Not only are we where America needs physicians the most, but we're prepared to provide the medical care that America's underserved communities need and deserve.
If this mission speaks to you, especially to your calling as a physician, check us out, seriously. We are providing the best primary care training available, and hands down, I attest to that, within the mission that speaks to humanitarian values.
Yes, Anthony, if this is what you're looking for, please visit us online at www.authorityhealth.org or call us at 313-871-3751.